We need painkillers more than often we can imagine their role in our lives. It's used in case of post-surgical pain management, diseases involving excruciating pain, fever or any anomaly regarding pain management. Doctors prescribe various painkillers for the management of acute to severe pain depending upon a particular patient, like Panadol, Disprin, Brufen. There are three main types of painkiller: non-steroidal anti-inflammatory drugs, paracetamol, and opioids. Each works in a different way. They can be taken in a variety of forms, such as by mouth as liquids, tablets, or capsules, by injection, or into the rectum as suppositories. Most people only need to take painkillers for a few days or weeks at most, but some people need to take them for a long time. They act on the body through various types of mechanisms. The human brain receives signals of pain from different parts of the body and processes it in the pain centers of the brain. These painkillers act to block pain signals to reach brain, and hence pain is not felt by the brain. Cyclooxygenase enzyme is responsible for production of chemicals which mediate pain. So when this enzyme is blocked by these drugs, patient feels relieved of pain. The non-steroidal anti-inflammatory drugs, ibuprofen, diclofenac and naproxen, and aspirin. It is mainly prescribed in low doses to help to keep the blood from clotting for people who have had a heart attack in the past, to prevent the likelihood of another such event so that your heart keeps pumping normally. These work by blocking cyclooxygenase. They reduce pain and inflammation, so these drugs are usually prescribed for inflammatory diseases such as arthritis, gout and systemic lupus erythematosus. Paracetamol is thought to work by blocking cyclooxygenase enzyme in the brain and spinal cord. Is used to treat pain and to lower a high temperature. Is normally prescribed if your pain is not too serious and you do not have inflammation. Opioids work by binding to certain receptors. The opioid receptors in your central nervous system, your gut, and other parts of your body. This leads to a decrease in the way you feel pain. Opioids are usually prescribed for more severe pain, or if you have tried other drugs and they have not worked. There are some differences among various painkillers, as aspirin can irritate stomach, delays blood clotting, and it is anti-inflammatory as well in comparison to acetaminophen. However, pain management is the key ingredient in these drugs. Each drug is suitable for a specific person. Side effects include nausea, internal bleeding, vomiting, liver damage, constipation, breathing difficulty, dry mouth, hypersensitivity, headache, electrolyte imbalance, dizziness, Reyes syndrome. These are over-the-counter drugs easily available, and it can lead to scenarios of overconsumption leading to toxicity and death. In case of toxicity, are there any antidotes available? To answer this question, there is an antidote available called NAC, but time is of the essence. If the antidote is given in the first few hours of overdosage, it leads to full recovery and the patient does not fall ill. But if unforeseen circumstances occur and antidote is not given in due time, it leads to liver toxicity and can lead to death as a result of liver failure.